You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with migraine headaches, facial pain, or TMJ problems. And with us, we have an expert on the topic. He's a clinical instructor at the prestigious Las Vegas Institute. This is where dentists from all over the world literally go to learn about bite, about cosmetic dentistry, and TMJ problems and how to fix it. With us, we have Kevin Winters. Welcome to the program.
Thank you, Randy.
Now, for people that don't know your practice, right. I guess you're new to Austin. You've
Yes.
been practicing dentist for a long time.
Right.
So who's the typical patient that you see specifically for TMD problems or TMJ? And what is the difference between TMJ and TMD?
Well, so let's start there. TMJ is simply the name of the temporomandibular joint, which everybody has two of those. They're right here.
Okay.
So, but what has happened over time is all these various ailments get lumped into this TMJ category. It's actually a disorder, a dysfunction of the joint, of the jaw itself, and that's what the TMD is more about. So what we see with this as a typical patient, it's not really typical at all.
Okay.
We'll have young females come in that are college age, or the mother that's running a family, mid-40s, very stressed, but also exhibiting a lot of pain and discomfort in her face or popping and clicking in her joint. We also have the grandma that might come in, and she has gone through her whole life with a combination of maybe all of these things, some headaches, some neck issues, some facial pain issues, and maybe her teeth are worn, or the dentistry that she has done will chip or break, and she comes in and it's a combination of everything. Every now and then we get a guy that comes in. It's usually women, but we deal with men as well. Their symptoms usually have to be a little bit more dramatic, or they won't admit to it, because guys want to be tough, and they wait till the last minute and everything's okay. And of course at that point then things really have gone downhill.
Now migraine headaches. Let's start there for a moment, because you say that people that had migraines for like 5, 10, sometimes even longer years, you get reversals. That means their migraine headaches go away.
Absolutely.
How does a headache have anything to do with the way the teeth come together?
I know, and that's a great question, and one that I get all the time, because there's not really a correlation for most people to think all these headaches that I have, maybe in the back of your head or the temples or wherever it may be, how could that be at all related to my jaw, to my bite? Well, the thing that we know is that the jaw is just kind of sitting here in our face, but it's held and functions by muscles that come from the head down to the jaw, from the neck up to the jaw, from the back to the front. So
that's all happening like right there. Like this is the joint area?
That's the joint area, yes. Okay. But the jaw, all the way across your face here, is how it moves. These muscles contract and work together. And so there has to be a great coordination of everything working together. So if sometimes the bite, the teeth, put the jaw in the wrong position, then these muscles have to work harder and harder and then become symptomatic. The majority of symptomatic being headaches, being a number of other issues, like sometimes it's ear congestion, ear ringing in your ears, dizziness.
From the way your teeth come together?
Absolutely.
How?
Absolutely. Well,
same kind of mechanism?
Same mechanism. And one thing that you'll notice is your joint happens to be right in front of where your ear is here. And there's a communication between the joint area and the ear with a little nerve and some blood vessels and things that go into the inner ear. And so when these are compressed, or these have issues that the muscles not working properly have created, next thing you know, it throws balance off in your ear and you have dizziness. It throws kind of this dull ringing in your ear that can be there. And you go to the ENT, there's nothing wrong. Everything looks great, but yet these symptoms are there. So it reminds me of a lady that we saw, it's about a year ago. She had literally been to, I can't tell you how many different specialists to try to figure out what was going on with her ear. She had ear congestion, but more importantly, she had dizziness, which was then diagnosed as what's called Meniere's disease. So Meniere's disease is in the medical community, is one that you really can't treat. There's medication to try to help, manage the more bouts where things flare up, but there's no treatment for it. So somehow, and I don't remember how she found out about me other than probably through Google or something.
Okay.
But she came in the office and we go through our normal routine of gathering information and trying to find out what is underlying these situations for our patients. And with her being the ear being the main concern, one of the things that we talked about in her Meniere's is just what we're explaining here, how all this functions and works together. And by decompressing the jaw joint itself, getting some of the pressure off of this ear area could allow her to experience relief from these problems. And so, what's the worst thing that can happen? We're going to do a little procedure, put some plastic in your mouth and see if it works. Sure enough, it worked.
Is that
First
right?
time in over 20 years that she had not experienced a day of dizziness. And this happened within 2 days.
And it was based on the way her teeth were coming together?
Absolutely.
Like, so what, you make the teeth come together better, offers relief to this area,
So
the joint, and then...
the teeth, yes, but I'm going to reemphasize this again. It's jaw position, not tooth position.
Okay.
Now, so here's the difference. Your teeth can be wherever the teeth are. The jaw has to close to where the teeth are. The teeth dominate where the jaw goes.
All right.
So if the teeth are here, the jaw closes there. If the teeth are here, the jaw closes here. But the muscles that control the jaw may not be happy.
So it's a muscular problem.
It's a completely muscular problem.
Interesting.
So with muscles being the main concern, it takes me to a situation that's near and dear to my own heart. My daughter, as she got college age and was, studying and going through her normal day-to-day routine that college age students and young 20s have, she was always experiencing headaches. And of course, she didn't want to complain to Dad because, he's just Dad. What's he know about this stuff?
Yeah.
But yet and talking with her afterwards, it was almost debilitating to the fact, more than what I ever knew. And of course, when I find out later, I feel terrible about it. But this was something that she, and what I see in my own practice, is also very common with that age range of young women, is that they have tremendous headache problems. And if we can get things to relax, get the muscles that control the jaw to relax, headaches are gone just like that. The best thing about my daughter was that I knew what to do. It was already sitting right there in front of me. We came through, we got the diagnostic information that we needed to confirm this, but then it was just a process of allowing me to relax the muscles, give her what we call an orthotic to stabilize her bite in this new jaw position, and immediately headaches are gone.
Interesting.
Yeah.
And then, and they don't come back, or she wears an orthotic
Well,
here and there, or every night when she goes to sleep?
Typically when she sleeps, during the day as needed. So if it's a particularly stressful day, pop the orthotic in, things are stable, her face is able to relax, all the muscles relax, no problems, no symptoms, no headaches.
Is it hard for them to believe that, especially the migraine? Because look, if you have migraines, I know somebody personally that has migraines.
Yeah.
And they don't want to hear it, like that they're...
No, that's exactly right. And what you have to realize too is that these people have been to multiple physicians that say this or that, or take this drug, or take these shots to try to deal with migraines. And I'm telling them that if I can simply allow your jaw to relax and give you a different, more comfortable, neutral position to let these muscles calm down, you're going to be good. It's very skeptical. It's very skeptical that they think it can be that simple, because they've tried everything else. They've been
this happens
everywhere
like
else.
every week in your practice? Like somebody with migraines and now they don't have migraines?
Every week.
Really?
Every week. It's that predictable.
Is this like a word of mouth kind of a thing? Because it is hard to believe, even hearing this.
Yeah,
But I've seen some of the testimonials on your website.
That's true, and it's hard for people to understand. It really is, and I get that. So, we try to take them through a process to allow them to picture what could happen here. But really, the proof's in the pudding. If we can gain their trust, and through sharing other stories of situations that have been very similar and had positive results, many times in talking with some of these patients that have already been through it, if they can trust me to do it, I'm very confident that I can take care of these headaches.
Okay, so the people at home, right?
Right.
Can you put together or help us with it, like a self-assessment, a self-diagnosis?
Yeah.
Like, what are the obvious symptoms that they have a problem with their TMJ joint?
Like
what are the symptoms?
Yeah, I'll go through kind of a list of the more common ones, because the list can be this long. But Obviously, popping, clicking in your jaw joint. A lot of times people will think, oh, it's just normal. I've always done that. My grandma did that. You know, it's one of those things that just happens at the dinner table. If I'm chewing, I can pop my jaw. Isn't that funny? Ha ha ha.
Yeah.
Well, it's actually not. That's a warning sign. That's a sign that the joint itself and the components in the joint are being damaged. And when this happens day after day, week after week, year after year, you can get some debilitating problems later in life. So popping and clicking in your jaw is one of the more common ones. We've talked about it.
Popping and clicking, if there's no symptoms, why treat it? That's my question.
Yeah, and that's
like, it doesn't hurt. Just you get a popping and
it's
clicking.
a pop, it's a click, it's funny, it's it's not that big a deal. But what I can tell you is that I've dealt with these same people 10 and 15 and 20 and 30 years down the road when this has been going on, and now that popping and clicking that was so funny at the time has led to much more involved situations like headaches, like broken teeth, like dentistry that falls apart, like debilitating just facial pain problems, ear issues, neck issues. It's all tied together.
So for years, I've had a problem with clenching and grinding my teeth at night. I would wake up in the morning with really bad migraines. Eventually, I contacted Dr. Winters at the Hills Dental Spa, and he said that he thought he could help, so I figured I would give it a try. When I went in, they fitted me with an appliance that would hold my jaw in a relaxed position at night to prevent the clenching and the grinding. I could tell a difference right away. Within weeks, there was no more migraines, and the best part was that I could smile again.
I've tried a lot of different things during that time to relieve my TMJ type of symptoms. I've tried a lot of different light guards that were recommended over the years, and I was a little doubtful that a new, more advanced appliance would actually give me relief that the others didn't. After just a few short appointments, I got my new appliance, and after just one night, I was able to notice an immediate result in that I had no more clicking in my jaw. Just after wearing it that first night. After wearing it for a week at that time, I was able to notice a dramatic difference in my neck and shoulder tension and reduced headaches, so I'm a believer.
I now have the orthotic that I've gotten from Dr. Winters, and it has relieved all of my symptoms. I have so much more energy now. I get a lot more rest. I had no idea how much of my energy was wasted with my jaw clenching all day, all night. And I just have gotten so much relief, and I feel so much better.
So for you, is it kind of a easy fix? Like if somebody comes in, they have migraine headaches, they have sore jaw or popping, like some of the things you said, or they have dentistry that you say is breaking all the time, nothing will ever last.
Right.
They might have a bite problem.
Yeah.
How soon before, because I know you hook them up to machines and check their muscles.
Yeah.
How soon before you say, I think I could do this?
Well,
I think this will work for you.
Right. Let me show you a picture here of what the patient looks like hooked up to some of our technology.
Okay.
So we have some very advanced computer technology that is what I refer to, it's kind of like running an EKG on your head and neck. Okay, you know, if you go to your physician, you can put a stethoscope on your heart and he can tell you a couple things, or you can do an EKG and tell you all kinds of things. That's what we have for the muscles of the head and neck and how the jaw moves. And so, as you can see from the picture, it shows us live on the computer how the muscles are working as the jaw moves. Once they're inside the BioPack system that we have, we're able to determine exactly what muscle activity there is compared to where the jaw position is. And there's a sweet spot. There's this neutral place where all the muscles are kind of just, they're just sitting there saying, thank you. Thank you for letting me get to a point where I can heal. Because I couldn't heal before because these teeth keep telling me to go up here. But I want to be here or here, someplace else. This is where I'm comfortable. One thing I always tell people, and it's a great kind of test for this, if you were to lightly lick your lips and bring them just barely touching, just kind of relax your face, get very comfortable, what you'll find when you do that is there's a space between your teeth. That's the muscle saying, I'd really like to be down here. But they can't, because the teeth say, sorry, you got to go back here. They're back into that cycle of working and working. And this approach is entirely different than what traditional dentistry has had to offer.
For TMJ problems.
For TMJ problems.
Okay.
Again, it's about joint and bones and teeth, and you know they'll make a splint and say, here, wear the splint and you'll be fine. Well,
But the splints work though.
sometimes. Long term, many times the splint will actually create other problems that
Okay.
end up having to be fixed after the fact. So there are times when a splint will work for someone. I like to refer to this as having goalposts. You know, in some people they have wide goalposts. So if you get them a splint and you're somewhere between the goalposts, hey, that's good. Some people have goalposts that are this wide. And you've got to be right here, or that splint is not going to do a thing, or it's going to make them worse. So we're able to get on the 50-yard line. We're able to get in these narrow goalpost people by the use of our technology and know exactly where the muscles want to be for that person, not just a one-size-fits-all approach by using a splint.
Okay, so when they go to you call it neuromuscular dentistry?
Or physiologic dentistry.
Physiologic dentistry.
Right.
Which is basically mimicking the way your mouth is supposed to come together.
That's right.
The way your muscles are comfortable.
That's
So
exactly
really
right.
it's a muscle problem causing tension headaches.
Yes.
Cluster headaches.
Yes.
Because what? The nerves that are here go up into the head?
Well,
or what is it?
No, this large muscle on the side of your head right here hooks down directly into your jaw. This is called the temporalis muscle. This is one of the main problem areas that people have with headaches. Now, we also have many times occipital or back of the head headaches. But again, these muscles tie into jaw position. And whether it be in the front, right in the middle, an eye headache, headaches in general, although there are a few exceptions to this, but in general are muscle-related problems.
Good. Now you brought photos. What are we looking at?
Yeah, you know, let me show you a particular patient. This is Faye. Faye came to me, and she's just the sweetest lady. I mean, she's mid-60s at the time, and I'd been seeing her for a while, and she's just calm and just the sensitive, perfect grandma type person. But yet, she had a lot of issues with worn teeth, with teeth that were chipping and breaking. And so I started talking to her about, you know, why do you think this is happening? Well, I'm just getting old, and I'm a grandma. And I said, but Faye, that's not the case. Teeth don't chip and break just because you think you're getting old. There has to be a reason for this. So let me ask you a few other questions. And so I went through my process of talking about headaches or clenching and grinding and ear issues, things like this. And sure enough, Faye, almost reluctantly, because that just wasn't her, she started telling me about some of the stories that she had experienced or situations she had experienced through her life related to just not feeling good because her face hurt so much.
Interesting. Okay.
And so as I took Faye further into this, she really opened up and said, you know, there are times I just don't want to leave the house. I miss playing with my grandkids.
Because of facial pain.
I just feel
headaches.
terrible. I feel terrible. I don't want to get out of bed. And I'm missing time with my grandkids, and you know, I don't feel like I'm being a good wife. And this affects me. This really does. And so after talking some more and explaining kind of what I could do for her, Faye started the process. And we took her from a lady that just was kind of very reserved and not herself, to one that was completely pain-free. So now here's after. And aside from the smile, she has a wonderful, beautiful new smile here, which is fantastic. It's kind of a side benefit of sometimes the solution for this problem. But look at the rest of her face compared to the beginning. Look at how much more relaxed her face looks. Look at her eyes. The eyes tell this so many times, and how the wrinkles are less. The jaw itself looks more comfortable. It's just, she's not so scrunched together like this when you look at the before picture. Now this is a relaxed, happy, vibrant woman again.
So how many years was she in discomfort with?
Over 20.
Over 20 years.
Over 20.
And then she gets involved in your program within weeks.
Yeah.
It's reversed.
That's right.
Really?
That's right. That predicament.
Now I know we're supposed to say results not typical, results may vary, but is this somewhat
is common.
typical?
This is common.
Very common in your practice.
This is common, absolutely. Reminds me of another guy here I'm going to show you. This is Herb. Herb is just kind of your good old boy that is a rancher. He's been involved with just hard physical labor his entire life. And he came into me and said that, you know, he was worried about some of his teeth had chipped. He thought he might have a cavity. Wanted to get his teeth cleaned, and didn't really have any issues because, you know, he's a tough guy. And so we took him through our process, looked at things, and his mouth was actually a disaster. His lower teeth in particular were ground down to just nubs, but not untypical, no symptoms. You know, he wasn't a pain guy, no pain.
Okay.
He didn't have headaches. But what he did have was lack of energy about midway through the day. He can't work like he used to anymore.
All right.
And he had issues with his neck, and his mobility just wasn't the way it used to be, and his labor through the day was being affected by that. And so we started talking to him more about some of the things that could be contributing to this. And so I asked him about his sleep issues. You know, was he having trouble sleeping? Does he snore? He said, oh my God, I sound like a train when I'm snoring. And so we went down that path, because what we know is that snoring is related to what's called sleep apnea or sleep breathing disorders, which has a direct correlation to TMJ issues. And so we know by looking at his teeth that there's definite wear and problems.
So when you
in his
see,
mouth.
like when I look at his teeth and they look jagged or a little, that's because he has
that's because
a bite problem.
The bite problem
that he's probably doing in the middle of the night when he's not even aware of it.
That's right. And that's
And
also
breaking his teeth.
directly related to the sleep issue that he has. So after we hooked him up to our BioPack, got all the information that we needed, it was very obvious what his issues were. And so we talked to Herb about that, and he decided to go ahead and go through treatment.
So by the way, on this machine you hook him up to,
Yes.
it's like an EKG to the heart, but this is measuring the activity of the muscles in
That's
the
right.
face.
That's right.
So what does it show, like a lot of things going on? Like it's
It looks
overfiring?
you've seen on TV the EKG that has muscles like this. So the more active a muscle is, the greater the
So
activity.
you saw that with him. It's like,
Yeah, and his is on fire. You know, they're just, you know, lines everywhere. And so once we've found that comfortable bite, it's like he was dead, obviously.
Yeah.
He wasn't, but the muscles were just now comfortable. And so we finished the process on him. He ended up with an incredible smile.
take a look at this guy. Okay, looking
Look at this.
good, looking good.
He looks great, but more importantly, he feels good. He's got energy in the afternoon because at the same time with this new job position, his sleep apnea was taken care of, and now he has energy to get through the rest of his day. So look at the before and after pictures here. You can see, I mean, obviously he's got a fantastic smile. He looks great, but more importantly, now he feels great. And that's what, for him, was so important, because now he can get back to doing what he's always done, you know, on his ranch and being productive. And I kind of like the comments he got from his wife as well at the same time with his new smile.
So the people watch, like if they have migraine, headaches, whatever, they go in, right?
Yeah.
Because they go in, you hook them up to the machine, you'll know if they have overactive muscles in their
Right.
face.
Right.
And you'll be able to say, I think we know.
Yeah, if
part of
that's
the
the
problem.
case, if we get the information back from our diagnostic phase and that proves what I think may be going on, I can help you.
I know it's hard to prove, but would you say that most migraine headaches, most tension headaches, cluster headaches, they have a bunch of different names for headaches, are caused because of the muscles in the face?
Yes, absolutely.
Really?
Absolutely. There's no question about it, because, I mean, if you have a person who has this problem and we get their jaw in a comfortable position, support it there, and the symptoms go away, 1 + 1 is 2. You know, it can be that simple. So
I mean, some of these treatments could be affordable, right?
they can be, yeah.
Like some could be very small, little tweaks that can change their bite, or no?
Well, yes, we can. In some people, we can simply make the teeth fit together a little bit better, take away some of the things that are bad as far as how they come together. But more times than not, it's more a situation of changing the position of the jaw, and then we can rebuild the teeth to that point. Or we could use orthodontics in a special way to bring the teeth together at that good jaw position.
But the main thing is getting them out of pain immediately. So you can make like an appliance that'll do that.
The first thing that we have to do is get the patient comfortable. And where we go from there, again, could be orthodontics. It could be a full reconstruction if the teeth are broken down and have a lot of history of dentistry on them. It could be sometimes we just give them this special type of orthotic or splint, and that's all that they need. So everyone's different on it, but we start with comfort. We got to get you comfortable.
Time for a couple more.
Okay. So Randy, here's another lady that came to see us with a list of medications. Her daughter came with her at the time, and her daughter actually broke down crying to me, telling me about the discomfort and problems that her mother was having and how she wasn't her mom anymore. And so we went through our process. We hooked her up to our technology, found out what was going on, had a very good reason to think that this was something we could help with. Started her in the process, got her in the initial orthotic therapy, and the symptoms one after another began to improve. That proved that we were going down the right path. We finished up by changing her smile, rebuilding her bite, and the after picture that we see here now.
Very nice.
I mean, she looks fantastic, but more importantly, she feels fantastic. And her daughter, kind of the same as when she came in, now she's coming in giving me hugs and is so happy she's got her mom back. And this is just
So the neck pain, the
gone,
headaches, gone.
Everything's gone. All the medication, gone.
All because of the way her teeth came together.
100%.
You fix the muscles, relax the muscles in the face,
Yes.
and the headaches go away.
Yes.
Now, what about women in their 40s, right?
Yeah.
I knew you were coming here today.
Yeah.
I know somebody in particular in their 40s, and they say, look, and they live with migraines.
Yeah.
And they say, don't try, look, there's no way my teeth have anything to do with it. I had good orthodontics, I had this and that.
Yeah.
Is that typical, like where they're just, like, they don't want to hear it?
Yeah.
But it's worth a try. I mean, go in there, get hooked up to your machine. You'll know whether or not you can help them.
That's true, but they haven't read about it in magazines.
Okay.
None of their friends have had it. You know, possibly there's, at that point, there could be some hormone things going on, so it's got to be the hormones. It's got to be something else other than what could be a very obvious solution. So for most of these people, if they would just give us a chance to go through our process, I can very predictably take care of headache problems for them.
So those strong headaches.
Absolutely.
So young and old?
Young and
But
old.
what if you've had headaches for 20 years?
It doesn't matter. There's a reason why that's there. Now, there's a small subset of people that have some other crazy stuff that contribute to headaches.
Yeah.
But I'm just talking about, you know, if we were to put percentages on
The
this,
majority of people.
the majority of people have muscle-related headaches. So let's get the muscles comfortable. I mean, it just makes sense when you think about it. If all of this were relaxed, I probably wouldn't have problems.
So this has become like a big mainstream situation where dentists now have been the go-to people for helping people with bite issues or with TMJ problems.
Well, with TMJ problems, yes, but this approach is not mainstream. This approach is the opposite of mainstream. There's not many dentists that know how to do this. And so my approach and
Like just a few thousand in the world, right? I mean,
Yeah.
Las Vegas Institute is
That's
where
right.
they teach this.
That's right. And so in the big number of dentists that there are, there's just a small percentage that have gone through this training and understand this philosophy.
So at least get the consult.
At least get the consult.
The free consultation?
Yes, absolutely.
Okay.
And you know, it's tested, it works. We've got multitudes of people that have been through this process. It's something that, as crazy as it may sound to you, it absolutely works.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.